Hi everyone and welcome to today's community webinar. My name is Natasha Holland and I'm the Membership Manager here at Diabetes Australia. Today's webinar is brought to you by our corporate partner Audica, and we have Nimi Naran, audiologist and National Clinical Training Manager. She is an experienced audiologist with a strong foundation in psychology who will shed light on the latest research findings, offering valuable insights into the mechanisms underlying the relationships between diabetes and hearing loss. Nimi will also be available to answer your questions at the end of the presentation, so please feel free to use the chat function. Before we start, just a few pieces of housekeeping. Today's webinar will be recorded and will be available on Diabetes Connect. So if you don't want your face shown, please feel free to turn off your video now. Also, just a reminder to keep yourself on mute. We're really encouraging you to ask your questions. This is your chance to get an answer to any of your burning questions that you have. So at the top of your screen, you should see a little chat section. If you can't actually see it there, maybe try pressing under more and it'll just be listed there for you. So I'll read these questions out to Nimi at the end of the presentation. And just with all our external presenters, I just need to read out a disclaimer. The opinions expressed by Nimi in this webinar do not necessarily reflect the views of Diabetes Australia. If this has raised questions for you, please contact your GP or diabetes educator. So I'll now read out our acknowledgement of country. Diabetes Australia acknowledges Aboriginal and Torres Strait Islander peoples as the traditional owners and custodians of this country. We recognise their connection to land, waters, wind and culture. We pay the utmost respect to them, their cultures and their elders past and present. We extend that respect to the Aboriginal and Torres Strait Islander people here today. We recognise that Diabetes Australia is made up of hundreds of different Aboriginal and Torres Strait Islander groups, each with their own histories, culture, language and belief systems. Their relationship with country remains of utmost importance as it is the foundation for culture, family and kinships, songlines and languages. Diabetes Australia is committed to improving health outcomes for all Aboriginal and Torres Strait Islander people affected by diabetes and those at risk. So I'm now pleased to hand over to Nimi. Nimi, thank you so much for joining us today. Over to you.
Thank you so much. Firstly, good morning or good afternoon, depending on where you're joining us from Australia. But firstly, thank you to Diabetes Australia for giving me the opportunity to educate today. And thank you for everyone joining today. I hope you have an exciting session and you learn something by the end of it. So today I'm going to be exploring the link between diabetes and hearing loss. It's often a link that isn't talked about a lot by healthcare professionals or just in general. I'll be shedding some light on this unheard connection. So what's on the agenda for today? We will talk about facts about hearing loss, how our ears actually work. I'll review the types and causes of hearing loss, and of course, the star of the event, the connection between diabetes and hearing loss. I'll also explore the effects of hearing loss on ourselves, but as well as the people around us. And lastly, I'll talk about the services that we offer at Audica and how we can support you and your hearing health. Now, today is an opportunity to build your understanding of the profound influence hearing plays in our everyday lives. Our hearing is something that I truly believe connects us to the world around us, and I think more importantly, connects us to the people around us. It allows us to continue to engage in activities that we love or work that we do, and in doing so, keeps our brain healthy. When we lose this vital sense of hearing, studies have shown that it can lead to social isolation, loneliness, depression, and even cognitive decline. Now, let me ask you a couple of questions. And for those of you that are familiar with using this platform, if you click on the chat function, pop in the chat some of your answers to the questions that I'm going to be asking. Who here gets a regular checkup with their GP? And I'll give you a couple of seconds to find the chat and pop that in the chat function if you can. Got a couple of yeses. Yep. That's great to hear. Really important to continuously get your health checked with your GP. Who here gets their eyes tested every 12 months? Seeing a lot of yeses come through, which is really good. One's a little bit of a harder one, but who gets their teeth checked every 6 months? Oh, I've got a couple of yeses. You guys are good. I'm not in that category, I can tell you that. Beautiful. And lastly, who gets their hearing checked every 12 months? I'm seeing a couple of yeses, which is good. I often see in the work that I do that not a lot of people prioritize their hearing health. Despite all this research showing the effects of hearing loss on our mental health and our emotional well-being, many people wait on average around 7 years before seeking help as well as treating their hearing loss. So that for me is 7 years of being disconnected from the world around you. 7 years of being disconnected from the people around you, and also 7 years of isolation. As for me, as a passionate audiologist, this is something that I hope to change as I work within the industry. So let's now explore a couple of facts about hearing loss. So firstly, hearing loss affects 1 in 7 Australians, with hearing loss affecting more than 3 million people in Australia, which makes up about 14% of our population. It's more important than ever that we understand hearing loss, understand the wider impact that it may have on our well-being, and also how to access quality hearing care. Hearing loss can affect us at any age, but the prevalence of hearing loss does increase as we get older. And unfortunately, for the men that are listening today, hearing loss is also more common in men compared to women. So, how common is hearing loss at different ages? So, approximately 30% of adults aged between 51 and 60 have a hearing loss. As we get a little bit older, around 59% of adults have hearing loss aged between 61 and 70. And then approximately 74% of adults aged over 71 have a hearing loss. So you can see as we age, hearing loss does become more prevalent and sort of speaks to the importance of hearing health. Hearing loss is also a significant concern for many Australians, particularly as they age, as we've seen in the previous slide. But research also shows us hearing is reported to be the third most prevalent age-related health concern in adults that are over 75, following arthritis and hypertension. So if we look to our future, the World Health Organization predicts by 2050, 1 in 4 people globally will be living with hearing loss. This is not an issue that is going away, and it's important for us to educate ourselves and stay hearing healthy. So next, let's explore how our ear actually works. So the ear is made up of 3 parts: the outer ear, the middle ear, and the inner ear. And you can see that at the top of the screen in blue. When someone is talking to us, those vibrations travel out of the mouth into the air. They travel across the room and they funnel into the ear canal, where they travel down to our eardrum. As it hits the eardrum, it vibrates or bounces the eardrum and the 3 middle ear bones, which are all connected. This then passes that down to our inner ear or our cochlea, where thousands and thousands of hair cells are waiting for them. The hair cells pick up that vibration and send a message to our brain to process the sound that we've heard. Now, hearing loss is something that can occur at any stage. So it can be damage or obstruction to any 3 parts of the ear. So the outer ear, the middle ear, or the inner ear. Blockages or damage to the outer and middle ear are often temporary and can be resolved by medical intervention, while damage to the inner ear tends to be more permanent and often requires assistance with hearing devices, assistive listening devices, or even implants. Now let's explore the types and causes of hearing loss. Now, there are three types of hearing loss. There's conductive hearing loss, sensory neural hearing loss, and mixed hearing loss. Conductive hearing loss is related to a damage or a dysfunction, essentially, in our outer or middle ear that prevents the sound from effectively being transferred into the inner ear. This obstruction really prevents the sound from getting to our inner ear. Conductive losses are often, as I mentioned earlier, temporary and may be sort of resolved by medical intervention. But common causes of conductive hearing loss include excessive earwax in our ear canal, a damaged eardrum, an ear infection or fluid in our middle ear system, certain diseases that cause stiffness to the bones in the middle ear, or a fracture to the tiny bones in the middle ear, which is usually caused by an accident. Sensory neural hearing loss is the most common type of hearing loss that we see every day. It's a result of a dysfunction in the delicate hair cells in our inner ear or our cochlea, or the auditory nerve, so essentially that pathway to the brain. So damage to the inner ear is usually permanent and more often requires assistance or support through assistive listening devices, hearing devices, or implants. So causes of sensory neural hearing loss include aging, so that simple wear and tear, exposure to excessively loud noises, some hereditary factors, some medications can also cause hearing loss, as well as auditory trauma like a head injury. The third type of hearing loss is a mixed hearing loss. And as I guess the name suggests, it's a combination of a sensory neural and a conductive hearing loss. Causes of a mixed hearing loss include a combination of sensory neural and conductive causes, which I discussed on the previous slides. Now, I guess what everyone's here to talk a little bit about is diabetes and hearing loss. So let's explore this connection. Now, research strongly and has consistently suggested that people living with diabetes compared to the general population are at a higher risk of developing hearing loss. Hearing loss is more than twice as common in adults living with type 2 diabetes compared to the general population. Now, a certain degree of hearing loss is quite common as we age, which we talked about a little bit earlier, but it's often accelerated and progressive in people living with diabetes, especially if blood glucose levels are not well controlled with medication, diet, or exercise. Furthermore, there's evidence also supporting the notion that diabetes-related hearing loss is not simply, I guess, an accelerated age-related hearing loss, because studies are showing there's a stronger association in people under the age of 60. Now, people living with diabetes are also at a higher risk of progressive hearing loss over time compared to the general population. Therefore, their hearing is likely to deteriorate at a faster rate compared to those without diabetes. Now, people who are pre-diabetic have also been in the research. So people with pre-diabetic where the blood sugar levels are higher than normal, but not quite classified as somebody living with diabetes yet, has definitely been considered. Research has shown pre-diabetics are also at risk, with studies showing a higher prevalence of hearing loss compared to those people with normal blood glucose levels. Now, we know it's really important for people who are living with diabetes to control blood glucose levels with medication, diet, or exercise. And research shows that the risk of hearing loss increases in patients with poor glycemic control. Now, the risk of sudden hearing loss is also greater for people who are living with diabetes, but this is particularly in two age categories, in 35 to 49, and for people who are 50 to 64 years of age. Now, it's really important here, if you do suspect you've had a sudden drop in your hearing, to visit your local Audica clinic with urgency. There is a window where intervention can be provided in this area to support hearing recovery, and it gives us the best chance of hearing recovery. So really important if your hearing does drop suddenly to go and see your local clinician. Now, let's understand, I guess, this link. While it's not known exactly why hearing loss is common among people living with diabetes, it is suggested that nerve damage caused by diabetes may affect the hearing nerve also. Research also believes prolonged high blood glucose levels may lead to hearing loss by affecting the supply of blood and oxygen to our ear, and therefore causes damage to the tiny nerves and blood vessels within our inner ear. Over time, these nerves and blood vessels become damaged and therefore affecting the person's ability to hear. Now, that link causality essentially hasn't been established in research. So there's a lot of research still undergoing to understand the link and what the causes are. So what can we do essentially? It's really important to talk to your doctor about any concerns you have related to hearing loss, as well as talking to your local hearing care professional. Book an annual hearing check to ensure you receive early diagnosis, and then routinely get your hearing reviewed every 12 months to monitor the progress of hearing. So let's explore now, I guess, the effects of hearing loss. So hearing loss can have a significant impact on our relationships as well as our well-being. Now, prior to this presentation, I was testing my brain on ways that I could show you what hearing loss was like in an online forum. So I want everyone to take a moment to try and read the paragraph that is on the screen. And I'll give you a couple of minutes to do that.
Me O and Willon, ERON, full stop. I mean, AOU away, O Cassandra, emote, and you will reel on in like reading. Kamaji Yure and connexual clue be able or ul under and I being O am. God knows what is the language used, but okay.
Thank you, Sharad, for reading that out loud. And as you can see, it was quite difficult to read. And I don't know about you, but didn't make a lot of sense to me. So thank you so much, Sharad, for coming off mute and reading that out. But essentially, you can see that, you couldn't make out a lot of the words that were in the paragraph. So essentially, it was unclear as to what was being said. Now, I want everyone to try again. This time, I've given you a lot more information. There's a lot less gaps in the text, and you'll probably understand more of the text in this slide and be able to sort of make out the conversation of the paragraph a little bit more. And I'll
When
pause.
you are untreated, yeah, go ahead.
I was going to say I'll give everybody a minute to read that, but if somebody does want to unmute and give a go, that would be nice. How did everyone go with that one? Could you see a few more of those words appearing and sort of filling in some of the gaps that you were seeing?
Hearing and hearing. What is the major thing?
Now,
The O and 10 will have often will only here. All H is missing from here. So here is here. Yeah.
thank you, Sharad, again for giving that a go. Now, this is what it would be like for someone who was in the early stages of hearing loss. They're missing some parts of speech, but they often will use their mental resources, lip reading, and context to sort of fill in the gaps of what they don't hear to understand what's being said. When hearing
Well,
loss becomes a bit more significant, there's more and more gaps that appear, and it becomes harder and harder to fill those gaps. So that's what we saw on the previous slide. So I popped back to the previous slide. This is what we see here, more and more gaps, and it's much harder to fill in the gaps and understand what's being said. And often what happens there, it causes more and more cognitive effort and often then causes fatigue because we're putting so much effort in trying to listen. And I did put the finished product on the slide so you can see the full paragraph there. So if you guys want to take a second to read that so you know what was being said in that particular paragraph. You don't have to read it out loud, but just for your own learning. So, what are some of the signs that you can look out for in yourself or in loved ones to indicate that a hearing loss is present? Firstly, you can hear, but it's difficult to understand speech, and speech may sound unclear to you. It's harder to sort of converse in a group setting compared to a one on one setting. You have difficulty understanding people unless they're facing you. So using a little bit of that lip reading skills, which is an unconscious skill. Often people don't think they lip read, but we all lip read to a certain extent. Now, because hearing loss affects our ability to understand speech clearly, you may feel like people are mumbling or need to turn the TV up louder than others would like to really understand the speech clearly. Listening with hearing loss often requires a lot of effort and can leave us feeling fatigued or less inclined to engage in conversation. Others will often notice the signs of hearing loss first compared to yourself. And if someone close to you is experiencing these signs, I really strongly suggest and recommend that you book yourself in for a hearing test to assess what's going on with your hearing. Next, I want to explore the effects of untreated hearing loss. So, firstly, it's a reduced ability to understand and follow conversation, especially in noise. It can be challenging to understand speech in crowds or understand accents. Socializing may become less rewarding and leading us to withdrawing, which is often easier. However, it's so important to stay social in situations and not rob ourselves and then of the enjoyment that we get from being active and being social. And this really helps us to age well. Psychological issues such as low mood and self-esteem are often effects of untreated hearing loss. Potential effects on our memory and our ability to recall information because we're using so much cognitive resources to listen. Some physical issues is often fatigue and headaches from spending so many resources on listening. We start withdrawing from social settings as well as relationships. The emotional impact of hearing loss is also often evident. You know, misunderstanding in some situations can be a little bit funny and a little bit of a joke, but at other times it can also be embarrassing or frustrating. It can be annoying despite our best efforts and really trying to listen as hard as we can, that we can't actually follow and hear the conversation. We sometimes get frustrated at ourselves, but we can also sometimes get frustrated at others. We can also become more self-conscious when we don't know what others are talking about, and we can feel embarrassed, flustered, or even disorientated when we contribute to the conversation, but it's not really aligned with what everyone's talking about because we've misheard. Hearing loss can often be a source of stress on a relationship with loved ones, friends, and family. So it's really important that you share the news of hearing loss, or if you're struggling to hear, and how this is impacting you, your family, and your friends. It can be really, really helpful to have that conversation. It provides us an opportunity for them to learn on how to better communicate so you can understand speech more easily. And also discussing hearing loss and the impact that it's having on you is really important. Let's talk about the services that we offer at Audica and how you can get support for your hearing health. So at Audica, we offer a comprehensive range of hearing services to support your hearing health. Our services include a free hearing checks, as well as full hearing assessments to understand your unique needs and your unique hearing. We provide subsidized hearing services and hearing devices for eligible pensioners and veterans through the Australian Government Hearing Services Program. Our state-of-the-art hearing device technology also ensures that you're receiving the best care available. We also offer a unique and tailored hearing rehabilitation package to each individual that we see, including a demonstration of what hearing devices sound like, as well as a 14-day device trial. For those needing additional support, we also provide assistive listening devices, custom fit earplugs, including musician plugs if needed. Now, if implantable technology is also suitable and needed, we have a streamlined referral pathway for this to ensure that every client that walks into an Audica clinic is getting the right solution for their hearing needs. Additionally, we also offer specialist services such as wax removal, tinnitus management in select clinics. At Audica, we are dedicated to helping achieve better hearing for every person that walks through our doors. At Audica, we're also really proud to help our clients remain confident in communicating with the people in their lives and experience the enjoyment of staying connected to the world around you and the people around you. Your hearing is something that is our expertise. Now, we understand that everybody's hearing journey is different and unique to them. So I encourage all of you to get your hearing checked with Audica. You can go to our website if you want more information about hearing, as well as the link between diabetes and hearing loss. You can see our website is listed on the slide there. You can also book an appointment by calling us on 1-800-773-304. or scan the QR code on the screen now to book an appointment. It's been an absolute pleasure talking to you today, and thank you so much everyone for interacting both in the chat as well as verbally. But I will open up the floor to any questions that may have come through in the chat.
Thank you so much, Nimi. That was really, really interesting. I learnt quite a lot from that, as I'm sure a lot of our members did as well. So if anyone has any questions, please feel free to start typing them into the chat now, or if you prefer, you can take yourself off mute as well and ask your question. So we have got one question come through. Is there any treatment for tinnitus? Now I can't pronounce it.
That's okay. Tinnitus is how we pronounce it in Australia. Absolutely, yes. If tinnitus is something that is disturbing you and it's your number one concern, 100% we can support with tinnitus management. The first step is always getting your hearing assessed. And then through that, we can also assess your tinnitus and support you with strategies, tactics, or even devices that can help with tinnitus.
Okay, so while we're waiting for any other questions to come through, just a couple we had asked beforehand. How do I know if I have hearing loss?
So, signs of hearing loss can include difficulty understanding conversation, both one on one, but also particularly in noisy environments. Asking people for repeats is a common sort of telltale sign of hearing loss. Things like turning up the TV to a louder level that others need in the home, or even the radio is the same, turning up the radio. Um, Another one is you feeling people mumble. It's often what we hear in the office. Oh, everyone mumbles these days, but sometimes that's to do with our hearing and us not hearing the speech clearly.
Thank you. Does anyone have any questions that they want to come off mute and ask, or put it in the chat? Just another one we got beforehand. What happens during a hearing test?
So in a hearing test, it's usually around a 60-minute appointment, and it'll often start with your clinician talking to you about your hearing health history and understanding what your hearing is, where you're having difficulties, as well as your hearing health, like if you have any dizziness or tinnitus or fullness in the ears. And there's a whole list of questions that we usually ask. Then we often will move into the testing phase of a hearing test. So clinicians will have a look in your ears to see how your eardrum and your ear canal is looking. We'll test your middle ear function with something that we call tympanometry. And then we'll often pop you in a booth where we'll do a hearing test, and you'll hear a series of beeps and whistles, and you basically have a button that you press every time you hear them. And we vary those sounds from loud to soft to really understand, I guess, the softest sound that you're hearing. We also will do speech testing to understand how your brain is interpreting sound that is coming in. At Audica, we then also do a demonstration of what hearing devices can do, or what normal speech sounds like with hearing devices on, if you do have a hearing loss. And then we'll talk through a rehabilitation. So depending on what we're seeing with the results, if there is a hearing loss present, we'll talk to you about what a rehabilitation program looks like, and what we feel is best for you. If you don't have a hearing loss, then we'll often talk to you about hearing health, protecting your ears, and routine sort of hearing checks. But that's usually what happens in a hearing test.
Great. So we just have a question in the chat from Tanya. Are there treatments aside from hearing aids that can help prevent further hearing loss?
Of course, whenever we're looking at preventing further hearing loss, it would be around noise exposure. So ensuring that when you are in sort of really noisy environments, that we are protecting your ears with noise plugs, for example, or if you're working in a noisy environment, wearing ear protection gear is really important. But with hearing devices, what they do if a hearing loss is present is they keep your hearing nerve and your hearing organ stimulated, as well as continue to stimulate the hearing parts of your brain. And this is what really then supports us as we age and as our hearing deteriorates.
Great. Another question in the chat. You discussed sudden hearing loss and a window for prevention. How long is that window open for?
The research is a little bit varied in this area, but we say within a 48-hour window is the common sort of number that's thrown in research. But we're always saying with a sudden hearing loss, the earlier we recognize that it's a sudden hearing loss and the earlier we get you on the appropriate medication, the better. So if you do suspect a sudden hearing loss, don't wait 48 hours, come in straight away. And any of our clinicians and any of our CCOs on the front desk will know that if somebody is reporting a sudden hearing loss, that to put them into the diary urgently, and the clinician will see them urgently.
Donna has a question. Do using hearing aids prevent further hearing loss?
That's a hard one to answer. What it does is it really continues to stimulate the brain and continues to help your brain understand speech. When in the research, what we've seen with people who have hearing loss, what happens often when it is untreated, other areas of the brain start to take over. So often it's our visual centers that start to sort of impede and take over the hearing centers of our brain. And we can see this on MRIs. But when somebody is treating their hearing loss with a hearing device or a cochlear implant, for example, so implantable technology, what then happens is that area of the brain that is dedicated to hearing continues to be dedicated to hearing. And therefore, as your hearing may progress, you're still understanding speech with the support of a hearing device or an implantable solution. So that's why it's important to, one, have your hearing tested, and then early intervention to ensure that other areas of the brain are not sort of taking over.
That's really interesting. Does anyone else have any other questions? I'll just give everyone a minute to add any into the chat there. Feel free to as well, if you prefer, just to come off mute and ask your question. That's possible as well. We've just got a thank you for today. Nice. Okay, so if we don't have any other questions, we just had someone, I think, come off mute as well. Did you have a question, Aru? No? Okay. Well, oh, sorry, we just had one come in then. Will hearing continue to decline while using an aid?
Hearing will continue to decline as we age, for sure. It's nothing that we can stop, essentially. It's just natural wear and tear as we age that hearing will decline. But what a hearing device does is help keep that area of your brain active, which is the important part.
Another thank you for such an important information. Okay, so thank you so much, everyone, for coming along today. I really appreciate your time, and thank you so much, Nimi, for coming to share your really important information with us. Just to let everyone know, we do actually have a series of webinars coming up with Audica, so please stay tuned and have a look at Diabetes Connect and our newsletters for more information of when they're coming out and also what the topic would be. So if anyone does have any feedback or any, I guess, anything they want to share for future webinars coming up, feel free to give us a call on 1800-177-055 or send us an email at community@diabetesaustralia.com.au or make a post in Diabetes Connect. But thank you, everyone, today. And also on the screen from Nimi there is anyone does want to have an appointment and get their hearing checked. The information on how to do that is on your screen. Have a great afternoon, everyone.
Thank you, everyone. Have a good day.
Thanks. Bye.
Thank you. Bye.
Thank you and bye.